So Kasturi, the changing trends on testing in your own institute, Bharti just said, even in your institute, the patients may be most willing, but are the providers willing? So have you changed the strategy in your own setting? Because I do remember a couple of years back when I had come, it was quite a battle to convince everybody. So how is the situation now?
Yeah, now it has changed a lot. In the past, what we used to do is like only selective screening. Only people with macrosomia, past history of BOH or IUD or elderly gravida, only selective screening was done. But now we do universal screening. Thanks to you, you started that initiative in our hospital. So now we do universal screening for all the patients who walk into our hospital. One is that is the biggest change. Second is, when we used to do in the past the test, I remember when we were students, what we used to take glycosuria as this test, those days, Benedict's test we used to do and glycosuria. Then came the blood sugar. Blood sugar also we used to call them, one is fasting and postprandial. And so patient they had to come from far off village, tribal, rural, it was very difficult for them. And for selective patients, we used to do GTT. Imagine for GTT, that patient has to come from a far off place fasting. Then after 1 hour, 2 hours, 3 hours. So, and previously also we used to tell her not to take sweets for previous 2-3 days. So for this one test, she had to prepare from 2-3 days as if it is a pre-operative preparation like that, and then come to the hospital and spend so much of time in the hospital, like fasting 1 sample, again 3 samples, and she has to take glucose. So whole day used to go in just one testing for the diabetes. This for selective screening used to do. But now, with this one-step DIPSI test, which you have introduced, which you made everybody sensitized, it's a big change. Now we are able to screen every patient who walks into our OPD, and irrespective of their meal, as soon as they come into this thing, we give them that 75 gram glucose, and we make them wait for 2 hours. In that 2 hours, they get their BP checked and other investigation, ultrasound, whatever. And after 2 hours, we do the test, and on spot we give the results. So it's made a huge change for the patients. It's just like walk in and then get it done and detect diabetes. It's so very changed. And one more thing changes. In the past, we used to call them in second trimester for screening. Second and third trimester. But now, the first visit only we screen. So first visit, again in the second trimester and in the third trimester. So we don't miss any of the patients who are going to be diabetes. So screening and detection is almost 100%. And you started that DIPSI screening in our hospital. We sensitized all our staff. I remember first time we attended was in Chennai. You had called me. So Chennai for that hotel. So there where I got sensitized, I came and sensitized our staff, and they started doing it. But a full 100% it was possible when you started. I think in 2018-19 we started that project in our hospital. Everybody got sensitized. Now everybody does this test.
Excellent.
Universal screening and in the first visit. It's excellent change in our hospital.
So, so Kasturi is at the top of the change makers list. Congratulations and thank you, Kasturi, because it's not easy in huge public settings. What is your one message to many other public hospitals in the state of Karnataka who are still having a mindset, no, we can't do this test universal. No, we can't. Even in last Kasoga, that is our state conference, they said, Madam, how do you say that maybe in small private practice you'll do, but in public it is not possible. So what is your message to them?
No, if we sensitize all our staff members, all the healthcare workers, everybody, tell them the importance, tell them that it is patient-friendly, doctor-friendly, and it is going to make a huge change for the patient, both for perinatal and maternal outcome and her long-term health also. If we sensitize everybody, so I tell everybody, please do universal screening. Do the screening in their first visit and in the second trimester and third trimester, and this one-step method. So it's very easy. You can give them the results there. You can advise them. Then you can advise the further diet, exercises, everything to the patient. So please do make it universal screening.
Again, my famous quote, where there is a will, there is a way, otherwise there are only excuses. Yeah, thank you, Kasturi, for being so strongly positive.